Hi guys, welcome back to my channel. It's been a while since I posted on this channel of mine. I do have my main channel, Mark Jana. If you want to subscribe to that, I talk about beauty and lifestyle related topics on there. And so this channel is purely about being a nurse. So I'm going to talk about my job, like what do I do specifically. So I am a nurse, but specifically I am an ICU nurse. And I'm going to start off by talking about how I became an ICU nurse, and then I'm going to venture on to the difference between a medical surgical nurse and an ICU nurse and what is it about really. So I have been a nurse for 7 years now. I started in the Philippines, and then in 2012 I moved to the US. I passed my NCLEX in 2013 or 14, I can't remember, and then I started practicing up to this day. So technically I was a medical surgical nurse for 5 years and then an ICU nurse for 2. So when I passed my NCLEX, I was able to be hired at a hospital with a 10-bed ICU. So fortunately, my credentials and my experience allowed me to be considered for that position, which I'm super grateful for. I never thought that ICU would be the direction that I'd be going to, but my mentor at that time was also a Filipina who has been an ICU nurse for many, many years. She's amazing. She's a very good friend of mine, and she's taught me so much. And a lot of other experienced nurses have also added to my learning experience. And of course I went through different classes and trainings and studied a lot about like the different things that you will encounter in ICU. So going back to being a medical surgical nurse, in the Philippines, they don't just throw you right away to a specific area like here in the US. We're allowed to rotate to special areas as well. So I've been in the ICU, and I've also been in the OR. So I have both of those experience as well as labor and delivery. So basically, I've had a little bit of everything. Now, when I became an ICU nurse, it's a 10-bed unit, and it's a small unit. We took care of medical ICU patients, surgical ICU. We took care of sepsis, COPDers that need to be in a vent, overdose patients, alcohol withdrawal that need to be medically sedated, and all that good stuff. The common things that require a higher level of care, like cardiac drips or different kind of drips, because in the medical surgical floor you can't run drips. You can't give basically medications that require close monitoring, because in the ICU we have the capabilities to have close monitoring for the patient. Like, we have them on monitor, we have them hooked on so many things, so we can really see what's going on with the body. Now, moving on to being in the ICU now that I work at, it's a level 2 trauma center, so we don't take care of neuro ICU patients, and we don't take care of trauma patients, but everything else we take care of. So I do take care of cardiac patients that are on drips or post-cath, fresh MI, a fresh stroke or a stroke inpatient, we take care of that. On top of everything else. So I've taken care of patients that have been on a vent, that have been catheterized, and we're also taking care of patients on balloon pumps, and all that good stuff. So it's definitely an incredible experience. I love it. It gives me fulfillment, and I'm passionate about it. So it's definitely a career that I want to pursue. So in relation to that, I'm actually in the process of reviewing for CCRN, which is the certification for critical care nurses. It's really not a big deal. Not a lot of hospitals require you to have a CCRN, but you do get extra points for that. You get an increase in pay, you get a bonus, and all that good stuff. So it basically just certifies that you are equipped with all the necessary knowledge and skills to take care of ICU patients. It doesn't gauge how good you are as a nurse. Basically, it's something that you study for. You take a 100-item test, and if you pass, I think the passing is 80%, 60 or 80, I'm not entirely sure, then you get the certification. So yeah, that's where I'm at. Now, if I were to compare a medical surgical nurse and an ICU nurse, basically, if you're a fresh graduate, the direction you're going for is a medical surgical nurse. That's just the entry level that you're going to have to go through. It's very rare that you get a fresh graduate and then they get assigned to ICU. It definitely is the hospital and the department's nurse manager. It's their prerogative whether or not they're willing to do that. My hospital has had experience hiring fresh new grads and just training them directly as ICU nurses, but they have long stopped that because they've realized that there were more fresh grad students that are not as equipped to take care of heavily sick patients than there were experienced nurses. So with that being said, being a medical surgical nurse allows you to accumulate all the skills and knowledge in real life settings that would really help you create critical thinking skills in the future as an ICU nurse or whatever higher level of care you're going to be working at. Like, you learn about time management, you learn about the effects of different therapies, pharmaceutical or like surgical therapies that are done for patients that are super sick. Well, not super sick, but are like sick enough but stable. You learn about like just the foundation of being a good nurse. I wouldn't compare like, oh, an ICU nurse is so much better than a medical surgical nurse. That's not how it is. ICU nurses were once medical surgical nurses. It's a higher level of care, which requires higher level of skills. Everybody started from the bottom, you know? I mean, everybody started somewhere. So it's just a different set of skills that you add on to your medical surgical skills. Because you're taking care of a lot sicker patients. They're heavy loads that sometimes require one-on-one. Like, we would have hypothermic patients, like patients on hypothermia protocols. We have patients that are paralyzed, you know, that require one-on-one. You know, we have patients that are on balloon pumps that require one-on-one care, you know. So you need training for that and knowledge and skills for that. So of course I had to go through different trainings and skills to take care of patients on a vent, take care of patients on a balloon pump, post-cap patients, you know, all these things. We have different monitoring systems like the FlowTrack or the NICOM and all these good things that require training and skills. So personally, I would prefer to have at least 2 years of medical surgical experience before diving into ICU as a profession. You can orient them and teach them about all the things that you need to know to be able to take care of a patient in the ICU, but without background experience that can back you up, it's very challenging to hint on subtle things that you could put together and create a decision that, hey, maybe this patient is septic, or hey, maybe this patient is having a stroke. You know, all these things that require close monitoring. Now, the emergency department is also a department that requires higher level of skills. It's sometimes, if not all the time, ICU can also cross-train to the emergency room. So my personal preference is ICU over emergency. Just because in the ER, you get everything. You know, you are the first encounter of these sick people. So you can get babies, you can get children, you can get like psychos, you can get psych patients, yeah, all these things. And it's basically it's organized chaos. It's you know that saying where if you're an ICU nurse, you're basically OCD. If you're an ER nurse, you're basically an adrenaline junkie. So you know, an ICU nurse can perform emergency room like nursing, you know. So so yeah, I just prefer ICU over ER. Of course, ER is something that is very challenging because you have to have certain skills that assess a patient and basically come up with a picture, an idea of what might be wrong with them, you know. So you can encounter so many things that are just, like I said, for adrenaline junkies, that's it. That's where you are. That's where you'll find your fix. But in ICU, it's more of an ongoing process. like being more meticulous, I guess. I don't know. You can still be meticulous in the ER, but it's time constrained. You got to be fast. You have to be quick about it. You know, you have to give them all the therapies, like fix it, boom, 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 you know? So that's a different, higher level of care at the same time. So once I get my CCRN, I would like to become a CRNA in the future. It doesn't require a CCRN certification, but if you want to be a certified registered nurse anesthetist, you have to have at least a number of hours experience in ICU. But being a CRNA is something that is way, way further ahead, and right now I'm very happy to be in the ICU. My goal is to work at a level 1 trauma center. There are different types of ICUs. In case you didn't know, there's a cardiac ICU, which you take care of patients that are post-CABG or open heart surgery, and just all cardiac patients. And then you have neuro ICUs that are all neuro patients, just strokes and like neurological problems, you know, and then trauma patients that have, you know, had like MVA or like stab wounds or gunshots and all these things, you know. A level 1 trauma center will allow me to take care of patients that have increased intracranial pressure because of a blunt force trauma or like trauma to the head that requires ventriculostomy, and all other monitoring and all other, like, it's just so much. But it's such, I'm so hungry for that, you know. And I had the opportunity to work at a level 1 trauma center, but I chose to go for the hospital I work at now, and I have no regrets. It was just a better commute. It was, I feel like it's a great environment to work in. It's not toxic. I love the people I work with. I love the opportunities that are provided for me, and I'm just overall just happy, you know. And I feel like that's the best thing that you can do for yourself as a nurse, because being a nurse in itself is already super hard work. You have to at least be in an environment that's not toxic, that doesn't deplete you of all that energy and emotional energy, you know. So yeah, I'm super happy. That is basically it for my job and me talking about medical surgical nurse and ICU nurse. If you have questions about being an ICU nurse, if there are topics that I have not touched on in this video, comment them below so I can have content for this channel. Yeah, and I guess that's it. I will talk to you next time. Bye.